I'm Dr. Rebecca Bowers, and I'm going to be discussing an exercise I call Sitbacks because it's kind of the opposite of a sit-up, and it is an exercise that I teach to many of my patients who have stenosis in their lumbar spine. It will not fix stenosis, and it is not a substitute for surgery, but what it can do is help train the core, abdominal, and back muscles to act as a brace to better support the spine. You should check with your doctor before starting this or any other exercises to make sure that they are appropriate for your particular individual healthcare needs. Please watch the video in its entirety first before you try to perform the sit-backs, because I will be breaking it down and going over some things that are important for you to keep in mind as you perform the exercise. Let's go over some rules. Number 1, make sure you get your doctor's okay before trying this exercise. The bench or stool that you use should be nice and sturdy and firmly planted on the floor. It shouldn't wobble, and it definitely should not have any wheels. This exercise should not hurt, not while you're doing it, and it should not cause any pain afterwards. If you do experience any pain while you're performing the exercise, stop. This means that it is being done incorrectly, or there is some other kind of musculoskeletal thing that needs to be addressed before you are able to do this exercise. The exercise should be done very slowly and very smoothly, which we'll go over more. And you're only going to want to tilt back just a few inches. A normal, healthy spine has curves, and in the low back area or lumbar region, that curve is called lordotic, where it tips backwards a little bit. When someone develops stenosis of their spinal canal or their neural foramina, the spine is no longer comfortable being held in that lordotic position and prefers to be held more straight. When only some of the back muscles or some of the core muscles are working too hard to try to straighten the spine, pain can be the result. Exercises that properly retrain the core to try to help it to hold the spine in a more straight position can sometimes help improve the function and decrease the pain that is associated with stenosis in this area. Two important things for performing the sit-backs correctly is 1, to make sure the torso is nice and straight, and 2, the motion should be coming from the pelvis, also known as your hips. In this picture, you can see that there is pink tape that has been put on the pants to show an angle. And when we watch the video in motion, you can see how that angle will increase as the pelvis is tipped back, and then it will decrease as the pelvis comes back forwards to be upright. Let us watch it in motion here. First, sucking in the gut and sitting up nice and straight. And then as you tilt the pelvis back and the angle increases, the spine still stays straight and you return back to the upright position. Let's break it down. First, sit on a sturdy bench or stool that will allow you to have your feet firmly planted on the floor and also has some room behind you so that you can lean back some. Then sit up nice and straight, sucking your gut in and keeping it sucked in during the whole exercise. Very slowly lean back by tilting your pelvis, not bending your spine. The torso should be straight and the gut sucked in for the whole motion. Only your pelvis tipping back should be what accomplishes the movement of the sit-backs. Only lean back as far as you can easily and slowly return back to upright. If you feel yourself straining or shaking at all, this is an indication that you've gone too far. The next time that you sit back, make sure that you don't sit back quite as far. After leaning back, you will want to return to an upright position, making sure that your torso has remained straight the entire time. Some people find it helpful to imagine a string at their chest, pulling them forward and up. Make sure that the return is just as slow and smooth as it was when you leaned back. You can do these sit-backs 3 to 5 repetitions, then relax your gut for a few seconds, Then you can repeat 2 to 4 more times if you like, and do these daily 3 to 5 times. Let's watch it again, remembering that the motion is going to be coming from the pelvis. First thing, we're going to sit up nice and straight and suck in that gut so that our torso is nice and straight. Then lean back as far as you comfortably can, making sure that the back torso is still nice and straight. I've been doing these for a while, so I can lean back a good 10-12 inches without any difficulty. But when you start out, you might only be able to go 3 or 4 inches. That's okay. This is about control, not about speed, and not about how far you can go. We want to retrain those core muscles so that they can move with accuracy and nice control. And then you want to sit back upright again, nice and slow. Now that you're familiar with how to properly do a sit back, let's watch how not to do a sit back. In this video, you'll end up seeing how the spine is extended and bent backwards. That is not how you want to do a sit back. Also, this was done too rapidly. You want to make sure the motion is nice and slow to retrain those muscles. Sometimes when people are just starting out with these, they find it helpful to place their hands upon their hip bones so they can remind themselves that this is the area that should be tilting or rotating back, and also so that they can try to feel that that area is actually what is tilting backwards. Other times people have difficulty performing the sit back exercise because some of their abdominal wall muscles are weak and being inhibited. Tapping on these weak muscles can help draw the nervous system's attention to them and encourage them to contract when you're doing the exercise. A well-trained healthcare professional or body worker should be able to assess and feel for which muscles are not properly contracting when you're performing the sit-backs and help you figure out which ones need to be tapped on, and even look for other causes that might be inhibiting those muscles and getting in the way of them contracting properly. Many people with mild to moderate stenosis in their lumbar spine are able to be more active while experiencing less pain when they properly perform these sit-back exercises, in combination with receiving hands-on manipulation from a physician or body worker trained in osteopathic manipulation. In order to ensure you are properly performing the sit-backs, it is helpful to have someone examine and guide you through the exercises in person so that it can be tailored to your needs. Also remember, online videos are never a substitute for medical care.